Hello, everyone, and welcome to another episode of the Overcoming Chronic Illness podcast. My name is Dr. Brian Rade, and I'm a naturopathic doctor. And today I am excited to be joined by a fellow naturopathic doctor, Dr. Lindsay Adrian. Dr. Adrian practices in beautiful British Columbia, Canada, so a fellow Canadian on the podcast once again. And I'm really excited to pick her brain. We've never actually met in person, but we've email corresponded a few times over the last couple of years about courses and different things. And I follow her on Instagram, and she seems to be a really smart cookie. And she's one of the few clinicians out there that I know of, at least, who has a focus in her practice on both oncology and complex chronic illness. And I do as well. And so I'm, just looking forward to seeing what she's excited about in practice, see what she's finding to be the most helpful for her patients. And from, again, her Instagram posts and what we've corresponded about, I get the impression that she's a bit of a continuing education addict as well, just like me, always doing courses, learning about new things. So I'm just looking forward to picking her brain and just seeing what's on her radar these days. So I'm just going to pause the recording here, and I'll be joined again in just a moment with Dr. Adrian. All right, everyone, welcome back to the podcast. I'm now joined by Dr. Adrian. Dr. Adrian, thanks so much for speaking with me today.
Thanks for having me.
It's my pleasure. So before we jump into all the myriad questions that I have for you, the brain picking that I alluded to in the intro that I recorded, would you mind just giving listeners slash viewers just a little background on who you are, how you got into working with the types of patients that you work with, and just tell us a little bit about your practice, please?
Absolutely. So I'm Dr. Lindsay Adrian. I practice in Vancouver, part of the greater Vancouver area here in British Columbia. My practice, much like yours, is very much sort of complex chronic disease and then integrative cancer care. And, whenever I say this, and I'm sure you get the same thing, people look at me like, why on earth would you do two such, massive fields that are seemingly so separate? And of course, the answer is that they are not separate. They are, all one big kind of continuum. And they have this root of an inflammatory process coupled with immune dysregulation. And so we really just are working on inflammation in the immune system. And then, yes, of course, there's these cell specific, person specific, condition specific things that we incorporate into that. But the sort of treatment modalities that we use actually have a huge amount of overlap in that complex chronic disease world, as well as the integrative cancer world. And so that's my practice. I really got into it because there was this big gap between how I found patients were experiencing health and well-being and health care, and how they could experience health care and health and well-being. And I really just wanted to fill that gap.
Wonderful. Yep, I've said analogous words myself over time, like where so they overlap a lot, and that's wonderful. Um, I'm wondering, just kind of off the top of your head, what are some of the things that you've learned from the, we'll say, complex chronic illness world, like folks dealing with chronic infections, mold illness, mast cell activation syndrome, all that wild, wacky stuff? Things that you've learned working with that patient population that's translated into your more oncology focus, like patients that come in with a cancer diagnosis?
Where I feel like it has the biggest translation is actually in, I guess I'll call it active recovery. So when somebody comes into my office and they have, a big tumor, and we are in, firefighting mode where we have to deal with this cancerous process, the tools that we're going to use are maybe a little bit different than the tools I would use in the mold mast cell activation syndrome world, because right at the moment we have a big fire we need to put out. But once I can sort of get that patient through the fire and then into trying to support just, continued stability, or what we call secondary prevention, which is a wonderful place to be in, where the cancer is managed either through surgery or a combination of different integrative tools. And now we get to just focus on, why did the cancer happen in the first place? That's where some of the biggest overlap is. with all of those different causative factors with toxins and mold and infections and the dysregulated cellular processes that allowed the cancer to happen in the first place. And then the repair and the recovery part of things. And, there is certainly a lot of repair and recovery that can happen during active treatment. But as you well know, when we work in the integrative setting, there are certain things that we can't necessarily do as aggressively while somebody's going through, say, chemotherapy, or with some of the targeted molecular therapies, even some of the herbs that I would really love to use to work on repair and immune system support. Sometimes I can't use them with certain uh, chemotherapies or targeted molecular therapies. Whereas if I get somebody through that need for that big active phase and into, like I said, stability and secondary prevention, now I can use glutathione and I can use some of these herbs that might affect liver breakdown pathways and things like that.
Great. Yeah, that's very, very well said. And I'm curious, like, to what extent would you say that, say, you're working with a patient, and let's say, the fire is, maybe down to the smoldering phase, or the fire seems to be put out, and it's kind of like, okay, we're feeling like optimistic, cautiously optimistic here. Um, but and we'd like to start working on more of those, root cause factors, getting the train of the patient's body, as healthy as possible to address whatever factors may have led to that carcinogenic process in the first place or the susceptibility in the first place. How much of the, like, kind of, maybe not pumping the brakes, but like how much of the holding back on that like relates more to like, we're just kind of worried about like drug interactions and things like that, and how much of it is related more to like this patient's like been going through a lot. Like we've been asking their body, like their immune system to work on, overdrive here, like trying to get this big fire, like get this tumor under control. We just don't want to ask the body to spend even more resources on like, detoxing and going after those, like hidden infections and this, that, and the other thing. Like could you speak to that a little bit?
Absolutely. I mean, this is just one of these moments, Brian, where I'm so excited to talk to somebody who really gets it. You totally do. I love this. I have patients, it's just like so many of us that come in guns a-blazing and they're like, yes, I've got this cancer, but I'm sure that I have all these infections and I have all these toxins. And, I just want you to just get rid of everything and just detox everything. And it's like, whoa, 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 whoa. Your body is a very empty well right now. And we just need to replete. You are so deficient and we gotta like wrap you up in like a burrito of weighted blankets and feed you soup and like get you like this image of grandma taking care of her grandkids, right? Like no, just sleep and rest and let's get some like basic nutrients into you. So yes, I mean, everybody's a little bit different. Everyone's got their own vitality, but the time to go guns a-blazing is not when somebody's vitality is at 10%. We need to do all those wonderful basic supportive things like eating good food that you can actually digest and getting some hydration in and resting and like actual constructive rest, not the kind of rest where you're going through active treatment and you're passing out because you've got nothing in the tank. I mean, like restorative rest. And let's just work on walking around the block before I'm going to hook you up to a bunch of IV therapies and just push, 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 push. So yes, we do need to rebuild the vitality of that individual and then be very intentional about what sorts of supports that we put in. And one of my things that I think is incredibly important and undervalued and perhaps underappreciated even by a lot of our conventional and integrative colleagues is sort of phased in interventions, right? Where, you don't do everything all at once. We want to work on the periphery and we want to work on what I call the basement, right? We need to restore the foundation of that building before we start gutting the kitchen in the upstairs, suite kind of thing. So yes, I hope that rebuild, replete before you go guns a-blazing. And killing stuff is actually probably the last step, not the first.
Yeah, I couldn't agree more. And I think you're the first guest I've had who's used a burrito analogy, so kudos for that, Lindsay. I'm a big fan of analogies and metaphors, and my patients oftentimes really say that they appreciate them as it helps them remember
Yes,
things. But
yes.
sometimes, like, yeah, I've gone way more off book than burritos. So that, anyways, that's great though. It was great. Um,
Uh,
and I'm just wondering, I have a couple of follow-up questions for you. I do have a question for you about the just some of the things you'd consider to be part of that foundational building. But just before I do, as I just always forget until too late in the podcast, I just want to mention to everyone, as per usual, nothing we talk about on any of these podcasts should be construed as medical advice. This is all for informational purposes only. If you need medical advice or healthcare advice, please talk to your healthcare provider to get that advice. Would you be able to speak to just what you'd consider some of that foundational support before you get into kitchen gutting and bathroom remodeling and all those other house renovating things?
yes, exactly. And so, I mean, some of it makes common sense, right? Some of that foundation is what food are you putting in your mouth? Are you able to digest that food? Part of it is hydration. Again, when you think about putting out the fire, well, it takes a hell of a lot of water to put out that fire, and a lot of it just gets sucked up and used up. And so we cannot replete or repair a dehydrated cell. Nothing moves in and nothing moves out of a dehydrated cell. So hydration is absolutely key. Movement is key. If we have stagnant lymphatics, stagnant blood, stagnation anywhere in our body, again, no nutrients in, no waste out. And so, um, foundation is eating, drinking, breathing, right? There's power. There's power in our breath. There's power in coming back into parasympathetic. There's power in getting our brain and our body back kind of on the same page. um, Movement, gentle movement. If you can go to the gym, fantastic. If you can't go to the gym, can you walk around your house? Can you take the stairs in your house? Can you get out to the end of the driveway and back? Starting small, but being consistent and continuing to sort of build on that as you get stronger. Um, all of those make up foundation from a very simplistic but very powerful way. And then beyond the actual, commonsensical things of foundation, to me, our minerals are foundational, whether that be, magnesium and zinc, which is so commonly deficient because our soil is deficient, but a really good sort of multi-mineral is really helpful. I love the B vitamins with the giant caveat that certain cancers, we really need to be careful about certain B vitamins. And so this is where I always have people speak to a knowledgeable integrative oncology practitioner. B9 in particular has a giant, I don't want to give excess B9 in somebody who has an immediate history of cancer. B9 prevents cancer, but once a person has cancer, there's a lot of caution with B9. And I would say to some extent, B12 can live in that world as well. Both of them are key methylators, and methylation is required for rapid cell division. And so it's not that there are absolute contraindications, but you need to work with a good practitioner to know when and how much for those particular ones. But B2, B3 are foundational. We need them. Our body needs them to repair. And so those are key. Um, and then just antioxidants, but I usually try to get those nutritionally as best as humanly possible. And protein. So many of our patients are protein deficient. It's
Mhm.
astounding how many of them are protein deficient. And if they've just come through that fire, holy man, are they protein deficient? And they're probably not eating enough protein either because they felt like crap.
Yeah, it's yeah, the protein piece. Like I've had so many patients are like, I'm so tired or feeling really depleted. It's like, oh, just get the protein in there. And it's like it doesn't take a lot of magic, just protein. And protein is kind of magical in and of itself. Um,
Yes.
this is kind of like a Hydra conversation here because every time I ask you a question, I have about two or three more questions that come up from each question, but
Love it.
anyways, we'll fill our time. It's going to be great. Just to clarify for folks, vitamin B9 is also known as folate. So just for clarification, because folks are wondering like, which one's B9 again? It's folate. And I'm just curious, bearing in mind this is not a continuing medical education credit certified podcast, so we could talk about products and things like that. Not that we're advocating any in particular. I'm just curious. Aside from like, I know there's companies like Seeking Health that have like not unmethylated multis and things like that. Is there a particular multi that you're or like a B complex that does not have those methylated B vitamins in it that you gravitate towards, or is it just individual Bs? And man, how do they name so many Bs out there? There's so many of them. So nice when it's in a complex, but they're
Yeah.
all methylated these days, which is kind of a good thing, bad thing.
Yeah, exactly. I find that because my patients are often mostly in British Columbia, but I have a lot of patients that travel from various places to come to me. And so then I always want to help them find things that are local to them as well. But most of the good quality B complexes, unfortunately, are too high in folic acid and B12, because that's also what makes them a good B complex is that they have those things. And so I typically end up staying away from B complexes and end up encouraging just a really nutrient dense diet. And then I'll use specific supports for the B vitamins that seem deficient. And that sounds ambiguous, but we've got really specific symptoms. So, and again, this is, you'll have noticed the same thing, but I always ask my patients um, how do they feel when they encounter various toxins? So, one of the things that I use is sensitivity to alcohol, especially if that's changed. And so if somebody tells me that in recent years they have a really hard time breaking down alcohol and they get quite sick quite quickly with alcohol, I know that their alcohol dehydrogenase pathway is probably not functioning fantastically. And this is a heavily B1 dependent pathway. And so I will use that as a barometer for their need for B1. So if they tell me they have a hard time with it, I give extra B1. There are all sorts of beautiful functional tests like organic acids tests that have markers for B2 levels and B6 levels. And so I like to use those, especially in that post active treatment phase where, again, now I'm looking at how are the mitochondria functioning, and is there specific places that I can support the function of those mitochondria? And kind of coming back to what's causative, what's correlative, but how do I help this person thrive now, and making sure that I'm not missing some of those foundational nutrients. So yeah, I guess that's the long form of, I don't really use complexes. There are a couple that have like 200 micrograms of folic acid and like 200 micrograms of methylcobalamin. Those I'm fine with, but yeah, I tend to cherry pick.
Okay. That makes sense. And me too, but I was just hoping you knew of something magical that I didn't know
I
about.
wish, I think we just need to collaborate and create like B complexes just for cancer
Perfect.
patients.
That's great. Yep. I've got like nothing booked. I have too much free time on my hands, so it sounds perfect. It
Oh,
sounds like you do
me
too.
too. Don't tell my husband or my children that I'm taking on another project.
Um, Secret safe with us. Don't worry. I do want to pick your brain about some non-oncology things as well. I just have two more questions. No promises. There might be more questions, but anyways, two more if you don't mind, and then we'll maybe switch gears a little bit. I'm just curious. One of the questions that I get all the time, and I'm sure you get it all the time as well, is like what should I be eating? And not that we need to get into when there's a cancer diagnosis afoot, and I know for me personally, like, my answer kind of differs depending on whether someone's, has an active cancer diagnosis or they're looking to prevent cancer because they have a, family history and what kind of cancer it is and all of that. But just curious, well, yeah, I'm curious, and was wondering if you wouldn't mind just speaking to, if say, Yeah, are there kind of general dietary parameters if a patient has an active cancer diagnosis, say they're like, a stage 3, stage 4, cancer diagnosis, they're undergoing active treatment with, chemo and or radiation therapy. Yeah, are there certain dietary parameters or a type of diet that you would generally recommend for those patients? Not that we're, of course, recommending anything to anyone listening.
Absolutely. So I follow what's called a whole foods low glycemic diet recommendation. So what I tell patients is we want high nutrient density foods that nourish your body, which sounds like no duh. But unfortunately, we're in North America not fantastic at that. So whole foods to me means minimally processed. If there is more than one step from how that food was grown or raised, then we're getting into gray zone or no-go zone. And so if you're going to have a grain, for example, I say brown rice is lovely. Brown rice flour is less so. And white rice flour even less, because the body's ability to convert that grain into sugar is substantially changed when we pulverize that grain. So whole foods, and then the second part of it is the low glycemic. Um, that makes up the bulk of my recommendation. And then I'm very particular, like we just talked about protein intake. And then I want a lot of those good fats. I'm very pro good fat. And, I think the data on combining omega-3 fatty acids, and in particular DHA, with pretty much all of our chemotherapies is quite astounding. There's less brain fog, there's better chemosensitivity, which means better outcomes. And so the Mediterranean diet is actually one of the few therapeutic, specific prescriptive interventions that has consistently positive results. And that's across, the full health spectrum, whether it's cancer, whether it's heart disease, diabetes, any of it. And I think a big part of that is that it's nutrient dense and it's got a lot of good fats. And it's very minimally processed. It's not free of red meat, but it's certainly not red meat forward. It's very vegetable forward. And so, again, in a nutshell, whole foods, minimally processed, low glycemic. We don't want to spike blood sugars. We want to keep blood sugars nice and steady. And the way that we do that is good protein intake, good fat intake, again, minimally processed.
Um, and then possibly the very last question here about the oncology side of things is just in terms of treatments that you recommend in practice. Of course, there are so many, nutraceuticals, IV therapies, various things that we can use to complement or as adjuncts to, chemotherapy, immunotherapy, radiation therapy, surgical interventions, etc. Just there's certain ones that are very well known, like curcumin and melatonin and things like that. Are there any I don't know, any therapies that you work with that maybe folks or wouldn't have heard about that are kind of go-tos for you? For example, like sometimes when folks come in to see me, like they're surprised to hear that we'll, work with intravenous mistletoe therapy. And like, oh, just mistletoe, Christmas, like, maybe it's like curcumin, yeah, mushrooms, yeah, like reishi mushroom, turkey tail, all these things. Any therapies that you work with that either the general public or clinicians might not be as familiar with that you're finding to be helpful in your integrative oncology practice?
Thank you. Yes, I'm very, very privileged to get to be, one of the few practitioners that has hyperthermia in my practice.
Oh, wow. I didn't know that.
Um,
That's great.
yeah, yeah. And so actually, I've gotten to work with local regional hyperthermia as part of my integrative oncology practice since I
Cool.
graduated.
Wow.
I was part of Dr. Gurdev Parmar's team at Integrated Health in 2011, 12, when he actually brought the technology from Germany and started actually, increasing the availability of that technology to North America. And now my current clinic, which is Port Moody Health in Port Moody, British Columbia,
Mhm.
we have the same technology. We have local regional hyperthermia. So that's a big one. It's very, very well known and used in Europe, but very limited availability in North America. Canada, I think there are 8 different clinics, but there's none in the US unless it's a clinical trial. So I think MD Anderson has one in a basement somewhere, um, and a couple of other places. But it's quite widely available in Mexico and Germany and Austria and India and Korea and everywhere else in the world. So that's a big one. And then I use a lot of red light therapy. I use the endo laser, so the Weber laser for intravenous laser applications, and lots of photodynamic therapy where I'm using photosensitizers, and then again, the laser application or red light applications. So we do that to prostates and rectums and oral cavities and skin, and all sorts of, wherever we can get a laser and wherever we can get photosensitizer. But then we use photodynamic therapy as well.
Cool. Yeah, those are nice tools to have in the tool bag. Yeah, and I didn't realize you'd. So did you with Dr. Parmar? Who for folks listening, he's like really brilliant, big deal in the integrative oncology community. Did you? So you worked. What was the connection again? You worked at his clinic or study with him, or what was?
So he was my mentor, and so I practiced with him as my mentor just out of my residency. So
Oh,
I
amazing.
did a general residency for a year, and then moved from that residency into practice with in the integrative oncology part of Dr. Parmar's clinic. And so I mentored with him for a few years. I ended up being at the clinic for 7 years, and then transitioned to another clinic, and I've been there for the last almost 6 years.
Wow, amazing. And just since you mentioned photodynamic therapy, I'll just quickly ask, and sorry, folks, just totally geeking out here, but which photodynamic agents do you work with? Like for, yeah, yes, which ones?
So, what's kind of neat is that there are lots of different natural agents that act as natural photosensitizers. And so, when I'm really needing to get deep into tissue, I'll use, fancy versions of chlorophyll. And so there's something called indocyanine green, or ICG, that has nanomolecular preparations and liposomal preparations that can be used. But even regular old green tea can be used. I have a couple of patients that have, unfortunately, tumors that have burst through the skin. And so I can do topical application of, curcumin, for example, which is a beautiful photosensitizer for blue light. And so then I get both the photosensitizing effect and the photodynamic effect with the curcumin, but also the antimicrobial effect of the blue or UV light wavelengths in that same area. Because, of course, the secondary infections in skin lesions are pretty devastating.
Awesome. Well, very, very cool tools. That's great. Well, switching gears here a little bit, outside of the oncology realm, just curious, what are some of the things in more of the complex chronic illness world that are sort of making you the most excited of late? What are yeah, some of the things that are more yeah, front and center on your radar these days?
Well, I mean, the people who are around me all the time know that I am just like an absolute physiology nerd, and I just adore digging into the roots of our physiology processes and how I can support people by really creating that fundamental shift in their physiology. And so, bile has been my giant nerd out arena right now for complex chronic disease, because we require good bile flow for elimination of all of our fat soluble toxins. And so, whether it's my Lyme patients or my mold patients, people don't get Lyme disease and chronic infections if something hasn't impacted their immune system in the first place, right? There had to have been something that left the door open. It's not just the tick bite. Because if it was just tick bites, we would have hundreds of thousands of people with Lyme disease. So it's more than just the exposure to the infection. Some people clear the infection on their own, just like some people clear strep throat on their own, and some people clear mono on their own, and then other people don't. And so those fat soluble toxins, unfortunately, are so frequently the culprit for what creates the mitochondrial dysfunction and the immune dysfunction that allows some of those infections to really take hold. So even if somebody comes in and they're saying, well, I don't think I'm toxic, I think I have an infection, oftentimes there's layers of, some of those various toxins. So bile is front and center. There's some fascinating research in the last 10 years that show that bile and bile acids are not just about digesting fat, although that is core, and clearing fat soluble toxins, which is core, but bile acids themselves act as signaling molecules. So we know now that there are actually both membrane-bound receptors as well as nuclear receptors that bile acids will bind to and then create a change in the physiology of that cell. And so this is what I've been nerding out on lately. There's really, really solid evidence that bile acids are what are regulating our metabolism. And so when we don't have good bile flow, when we don't have good production of bile acids, then we're getting fatty liver, we're getting high cholesterol levels, we're getting blood sugar dysregulations, and then we're getting hormonal changes. And all of that comes back to the actual signal, like the molecular signaling roles that those bile acids are playing, not just that physiological breaking down of fats and transporting them across membranes.
So what would be some of the reasons why folks might have a bile flow issue in the first place?
There are a whole bunch, which is unsurprising, but I think part of the reason that we're seeing such a problem with bile flow right now is that, again, all of those fat soluble toxins, not only do they require bile to eliminate them, they also gum up bile flow, and they sort of steal resources. So bile is produced in the liver, and some of the key nutrients required for healthy bile flow are phosphatidylcholine. Choline is found in our food, but it's found in fatty food, right? It's found in eggs, it's found in sunflower seeds, and it is found in corn and soy. But again, our corn and our soy are so genetically modified and processed now. I don't know how healthy the choline from those sources is. And we can make choline, but we have these really sort of intricate genetic pathways that are required. And so right at the moment, everyone is very heavily focused on methylation, for example. And we know that the methylation cycle bumps up against something called the methionine cycle. And it doesn't get nearly as much press. But within the methionine cycle is another set of genes, one of which is the PEMT gene. And this gene actually uses methionine and S-adenylmethionine in its conversion through to homocysteine, and it makes phosphatidylcholine, which then gets converted to choline. So if you don't have good folic acid cycling, then you're going to get stuck, and that's going to impair the production of choline. But also, if your PEMT gene is stuck, you can look like a functional folic acid issue and a functional methylation sort of deficit issue, but the problem can be that PEMT gene, and the problem can actually be related to the phosphatidylcholine to choline conversion, and then continuing to support the methionine cycle. So nutrients are a big part, genetics are a big part, the toxins that we're exposed to are a big part. And then the other things that help to make bile in the first place include core amino acids. And we just talked about how protein deficient people are. But taurine is a really integral amino acid, so is glycine, and they get used for a lot of things. And sometimes we can't keep up to our demand.
Um, so I think bile's fascinating as well, and I've gone down some rabbit holes, not as many as yours. I remember, or not as many as you've gone down, I should say. I remember seeing, I think, an Instagram post where you're like, my husband and kids are away, I'm geeking out on bile. It's like, oh, I'd like to peek over that shoulder and see what you've compiled. It's really, yeah, I think it's really fascinating stuff. But I'm just wondering at this point, are you still in the kind of like, I'm like researching, I'm like data compiling, I'm, putting together these theories and like, haven't have you had a chance to actually kind of see in clinical practice, has working on bioflow made a difference, or is it still something that's in the brainium level and hasn't quite made it into clinical practice level?
No, my patients are my guinea pigs. I'm pretty transparent with them. I always let them know when I've got something new percolating, and but I'm sure you're in the same boat where our patients have often seen so many other practitioners before they've seen us, and they've tried a lot of the really commonsensical things to try to get better, and they're coming to us because they aren't better. Things like those B vitamins and those foundational supports have not given them the traction that it has given other people. And so people have tried pushing detox, they've tried supporting the immune system, they've tried so many of these things, and either that patient has flared, so they felt worse, or it just did nothing. They just had no benefit to it. And so what I've found is the missing piece with a lot of these people is either bile flow or the other liver pathways that aren't glutathione, because everyone seems to be pretty good with glutathione, but all of the other, acetylation, methylation, the amino acid conjugation and the sulfation parts of things, they get forgotten about. And acetylation actually is a big one. I could go down that rabbit hole with you for a long time. Oh, and glucuronidation, which is the other one everyone forgets about, but again, is such an essential pathway. So, yes, I'm using bile flow supports in pretty much every one of my patients. Yes, it's been pivotal. It's made a huge difference in their ability to tolerate detoxification and in their day-to-day symptoms. I think I'd mentioned in some of these little posts that I put up some of the key flags for me that somebody might need bile flow support that are a bit unusual. So the ones that we all know about is things like you can't tolerate a fatty meal without some digestive upset. But some of the other weird ones, waking up at about 2 or 3 in the morning every night. 2 or 3 in the morning is part of the natural circadian rhythm of bile release. It's part of our taking out the garbage that happens while we sleep. And if we have cholestasis and impaired bile flow, your body wakes up, and I describe it like your body recognizes there's a disturbance in the force. And it doesn't quite know why there's a disturbance in the force, but something doesn't feel right. So you wake up. And if we're lucky, you get back to sleep. And if we're not so lucky, it takes a while to get back to sleep. But restoring normal bile flow in these guys, 9 times out of 10, they're sleeping.
Wow, that's really awesome. I'm jotting down that clinical pearl because yeah, sometimes it's
Good.
like, oh, we've tried everything and they're still, having a heck of a time sleeping. That's pretty great. Any
Right?
any other clues besides fatty food intolerance and waking at 2 to 3 in the morning?
Yeah. I mean, the other ones are a little more subtle. They're a little more based on the downstream effects. So I had sort of touched on the fact that there's all these signaling molecular implications with bile flow. But if somebody comes in and they have fatty liver or they have elevated GGT, so the cholangiocytes that line the biliary tree are really important for bile acid conjugation, and those cholangiocytes are what produces and releases gamma glutamyl transferase (GGT), and so when GGT is elevating, either those cells are being injured because of something direct, like a tumor, for example. They can be injured and can get elevated when there's a deficiency in glutathione. But the other big reason they go up is actually to do with cholestasis and a lack of good bile flow. So I'm looking for a combination of metabolic syndrome with some fatty liver, some elevated cholesterol levels, some blood sugar dysregulation. Certainly, if there are some fluctuations or slight elevations in GGT or ALT, again, those are more clues. Obviously, there are a lot of different things that can contribute to this whole picture. But to me, it's about pattern recognition, right? How many of these boxes can I check off in addition to exposures that that person has had? Things like taurine deficiency signs. So taurine is one of the main amino acids that's used to conjugate bile acids. Like I said, it's taurine and glycine, and we're far more likely to get taurine deficient than glycine deficient. Taurine is an integral amino acid for osmolarity balancing. So if people get water retention and puffiness, or if they have a lot of orthostatic hypotension, so a lot of dizziness when they stand up, or POTS type symptoms, difficulty maintaining a good blood pressure, they're sensitive to heat, for example, that can be associated with a lack of taurine because it's not able to shuttle the electrolytes to where they belong. Similarly, if you give somebody something like magnesium for muscle cramps and they get worse, the magnesium's not getting to where it's needed. It's not that the magnesium's wrong, it's that it's not being moved. And it's taurine that does the moving. So if you're missing taurine enough to not be able to move the osmolytes, to move the electrolytes, you're certainly missing taurine to be able to conjugate bile acids and to be able to do all of its other secondary jobs. And so, again, that's just an indication you just need to give taurine. And sometimes that's enough to unlock healthy bile production and bile flow.
I remember when I first learned that taurine is just so amazing, and I was like, like where has this knowledge been all my life? And it's like, yeah,
Right?
it's like all that stuff you said, and it's an antioxidant, and it's like crucial for mitochondrial function, and it's like, what doesn't it do?
Right?
GABA
It's
receptors, like just it just goes on and on. It's
I think my two favorite amino acids, taurine and cysteine, and acetylcysteine, those two. If I had to go to a desert island, I would bring those two amino acids with me.
okay. Well, those are good choices. Yep. Um, so in terms of helping folks with their bile flow, so minimizing exposure to toxins as best we can, which is challenge in this world, but do the best we can. Getting
Mhm.
enough protein in there, trying to make sure they're not taurine deficient. Um, are there what are some of the other kind of therapeutic agents? Like, are you using much phosphatidylcholine supplementation? What other kind of supplements or other interventions would you be working, like digestive bitters? Like, what else do you use for helping with that bile flow?
Absolutely. Okay. So, when we're talking about bile, we have like these multiple different sort of areas to think about, right? It's, do we have the nutrients naturally in our body to make it? Is there indications that there might be a deficiency? So again, we just talked about taurine and how important it is. Phosphatidylcholine is the other key component to healthy bile production. And I spoke briefly about the gene pathways required to both make phosphatidylcholine and convert to choline. So we need those. So I use a ton of phosphatidylcholine supplements in my practice. But when it comes to the liver itself and making bile from the liver, I use a lot of cholagogues, which are herbs that help sort of encourage that bile production. But we can eat bitter herbs and have great support for that liver bile production. I always remind patients that there was this sort of common practice of eating salad before dinner because back in the day, salad greens were very bitter. Now, unfortunately, we've bred the bitterness out of most of our salad greens. But if people buy an organic spring mix, for example, it tastes quite a bit more bitter than the non-organic one because it hasn't had those genes bred out. And so eating something bitter before a larger meal encourages bile production and improves digestion. Otherwise, you can actually use something like herbal bitters, and even just a few drops will do it. We can, eat things like dandelion greens, but in a supplemental form, I typically give herbal cholagogues. Again, this is not CME, so one of my favorites is the MediHerb line. I think they've done such a good job with therapeutic dosing in minimal tablets, right? So the Live Ton one is really nice and high in those cholagogues. But I definitely have patients who can't start there. It can be a bit too aggressive. And so for the sensitive people, I will often just start with the bitters, or I'll start with sort of a combination that has a little bit of bitters, a little bit of phosphatides, and a little bit of ox bile right in it, like an LVGB by Designs for Health, or like the Soroil I Call Plus when it's not back ordered for the last year, um,
Gotta love it
and
when
things
that
like this.
happens.
It drives me crazy. But yeah, so it's just it's about where is each person at in terms of their own vitality? How stuck are they? If somebody has been stuck for years, dumping cholagogues into them is going to feel awful. Just like dumping glutathione into them is going to feel awful. And that kind of comes back to our discussion at the beginning there about the cancer patient. We can't just take somebody who's got nothing and they're super deficient and start forcing detox and forcing, killing off these different microbes. If you've got somebody who's super sensitive and they haven't been detoxing for years very efficiently, we can't just start pushing those pathways. Sometimes we have to start with sprinkling in. And so phosphatidylcholine and taurine typically are very well tolerated.
Um, Really appreciate you sharing this, Dr. Adrian. And yeah, it's inspiring me to think more about cholagogues with my patients. I do think about bile on a regular basis, but yeah, the cholagogues, like I do use them, but not quite as much. So I appreciate you mentioning this for lots of reasons. And whenever you are going to lecture about this or put out some continuing education, I'd love to please email me and let me know because it's something I'd love to go down that rabbit hole too, but there's only so many hours in the day. So looking forward to learning about it from you at some point. I know we don't have a ton of time left, but are there any other things like maybe just rapid fire, like anything else that you're particularly excited about in practice, or just things where it's like, oh, this has been helping with my patients with complex chronic illness lately? Any other topics that spring to mind? Or things that you're excited about that you're going to be looking into, just wondering what's yeah, keeping you excited or extra excited these days besides bile.
Gotcha. Besides bile. My other big one that I love because it's applicable for everybody, and it is truly the future of medicine, is red light therapy. I just cannot overemphasize, the usefulness of this tool because red, and in particular the red wavelengths at like 660 nanometers, and then the near infrared at 880 nanometers, and in that sort of range, they are they deliver energy to cytochrome C on the mitochondria. Cytochrome C acts as a chromophore, where it absorbs those very specific wavelengths of energy. And that translates to a more efficient electron transport chain. And so, you can imagine these mitochondria, these very dynamic organelles, and they need to make energy, but they also need to be able to pivot quickly, and they need energy to be able to do that. And red light allows for that because all you're doing is delivering energy to the mitochondria. There is no side effects. There is nobody that doesn't benefit. I have had, children under 5 who've gone through chemotherapy, jump on a red light bed or get a red light panel at home, and have improvements in their energy and improvements in their vitality. It's part of that burrito kind of analogy, right? If your burrito can be made out of a red light blanket, even better. But I've also put 25-year-old elite athletes in there, and it speeds up their recovery. And I've put grandma in there who's recovering from a fall down the stairs and she's covered in bruises. She can go in the red light bed or get red light therapies. Red light is just, my prediction is that in the next 10 to 20 years, we will have red light therapies integrated into our beds, and we will all have our little recovery pods while we sleep. And this will actually just be part of our homes. It is that integral and that's simple.
Okay, that's a good prediction. Yeah, which if you don't mind sharing, like which red light bed or panel do you have in your clinic? Because it sounds like you have one there.
Yes, I have like 5 different kinds of red light therapies,
Okay.
targeted ones and laser ones and bed ones and big panels and little panels. So we have a Novathor bed, which is just a big, think of like a tanning bed, but it's
Those
all
are
red and
those
infrared
are really cool.
bulbs in it. It is so cool. And then the same company, Thor, makes a bunch of little handheld, like think of like a shower head size ones. And then I've got the Weber laser for more specific, like Acu laser or deeper penetrating red light. And then I use LS Pro for their flexible pads. But for patients, I often will have them buy their own and do it at home. And so I've looked into many of the companies out there, Cala, Red, Juve, all of these guys actually have done their research. They've got a good product. I'm sure there are more that are coming out every day. I started playing around with red lights in 2017 or 18. And it was expensive then, and it's not expensive anymore. It doesn't have to be expensive anymore because the technology is getting more efficient and cheaper. And so, for example, that Novathor bed was ridiculously expensive when we got it, but there are options now people can get at home that are very similar for five and six and $10,000 versus hundreds of thousands of dollars.
Wow.
So it's more accessible.
Yeah, we have a like a whole body red infrared light panel. We have the BioLight system at our clinic, and I've had probably like at least a dozen, if not like close to 2 dozen patients who like just went out and bought their own because they're just like, I love this and
Yeah,
I don't want to drive to your clinic. So I'm like, okay, well, good for BioLight, good for you. That's great.
yeah.
So yeah, when folks use it, they oftentimes really like it. How often do you find folks need to use the red light, infrared light panel to like kind of get an effect from it?
It's so dependent on their condition, right? If I'm using it for vitality after chemotherapy, anywhere from 3 times a week would be ideal. I've had people go 5 days a week, but even once a week when they come in for IV therapy gives them a boost. If I'm using it for an acute injury, so for example, if somebody has a broken bone or a severely sprained ankle, um, preferably they're doing 3 to 5 times a week. And so I have them get their own, unless they know that they're really just going to do that 2 week intervention and come to the clinic all those days. But if we're using it for something like general well being, once a week, twice a week, even single treatments, people do notice a shift. And so, like you say, those people who get the biggest advantages from them, most of the time they end up buying their own devices, which is fantastic. I just think it really will become standard in our homes.
Well, I hope so. Yeah, uh, I think it's yeah wonderful therapeutic benefits for folks too, and yeah, it's good to hear that the prices are coming down. I haven't looked at the prices for a while, but that's really good to hear. So it's nice when it's more accessible for folks. Um, well,
Mm-hmm.
Dr. Adrian, I know our time's kind of wound down here. Just before we wrap things up, could you just let folks know where they can find you, your clinic website, social media, anything else that you have for online offerings?
For sure. So my educational platforms really are Instagram, and I'm just at Dr. Lindsay Adrian, no dots, just Dr. and then Lindsay Adrian. I have a website that has been percolating in the background. It is almost ready to launch, and it's just going to be www.drlindsayadrian.com. But if you're on Instagram with me, when that launches, I'll post about that. Clinical inquiries go through my office. My clinic website is www.portmoodyhealth.com. And so just PortMoodyHealth.com. And that's just for any clinical inquiries.
Great. Well, I will put all of those links in the show notes or in the description if folks are watching this on YouTube. And yeah, Dr. Adrian, it was really a pleasure speaking with you. Thanks for taking the time to chat with me. It was wonderful to learn from you, and I'm looking forward to learning more from you in the future.
Thanks, Brian. It's so wonderful to connect with you finally, and I love learning from you too. I think it's so great when we can all collaborate and share knowledge. And like you said, there's only so many hours in a day, so I'll nerd out on bile, and you nerd out on something, and then we'll come together and share all of our information.
That's what it's all about. That sounds great. Well, thank you
Definitely.
again. And thank you, folks, for listening to this episode of the Overcoming Chronic Illness podcast. We hope you enjoyed it, and please stay tuned for the next one.